Mr. Speaker, this morning I rise before you and my honorable colleagues to share the plans that have been put in place to implement a saliva screening regime program in our public schools commencing Monday, May 24th. Mr. Speaker, having students in school for in-person learning is a priority. Additionally, ensuring that our schools and school environments are safe for staff and students is equally important. In light of this, the school staff are working diligently to keep COVID-19 from spreading in school buildings. Our schools are making tremendous efforts to keep students, staff, and by extension, our families safe and healthy by implementing safety and health protocols aligned with the Center of Disease Control and Prevention and other international health organizations. These safety and health protocols provide schools with a daily structure for applying the government's comprehensive prevention and controls measures aimed at protecting staff and students and mitigating and reducing the risk of transmitting COVID-19. Mr. Speaker, the entry to exit safety and health protocols for our schools are comprehensive documents and include universal prevention strategies such as 1. Morning screenings that include temperature taking. 2. Students and staff wearing face masks. 3. Hand washing and sanitizing. 4. Respiratory etiquette. 5. Physical distancing. 6. Using cohorts or bubbles. 7. Wearing personal protection equipment, PPE, when necessary. 8. Ensuring good ventilation in rooms. 9. Cleaning, sanitizing, and disinfecting rooms and frequently touched surfaces throughout the school day using EPA-approved products. And 10. Posting safety and health signs to promote safety and protective measures. We recognize that the implementation of one safety measure will not work on its own. Therefore, a combined approach of all of these prevention strategies mentioned above will reduce the transmission of COVID-19 and help keep our school environments safe. Mr. Speaker, in addition to the entry to exit safety and health protocols created for each school level, the Department of Health has used current research and best practice to develop another layer of safety-specific protocols to reduce the transmission of the COVID-19 virus. These include specific protocols for 1. Minibuses when transporting students to and from school. 2. Sitting exams in large rooms. 3. Field trips. And 4. The use of the computer labs. These protocols drill down and outline explicit practices that staff and students must follow to reduce the transmission of COVID-19 when engaging in these types of activities. As schools make every effort to implement these protocols, the Department of Health has made it very clear that the protocols must be strictly adhered to 100% of the time to reduce the spread of COVID-19. Mr. Speaker, the EEMC, the Education Emergency Measures Committee, met on May 3rd to discuss the implementation of yet another safety measure, the introduction of a saliva screening strategy for public and private schools. The saliva screening strategy provides a means for identifying and mitigating the risk for exposure of COVID-19 in school buildings. The goal is to use the saliva test as a screen to help break the chains of transmission quickly. The screening strategy will identify persons in our school who may be COVID-19 positive and asymptomatic. Health officials will then determine the exposure risk and put in place proper requirements to isolate individuals who have tested positive. The EEMC supported the introduction of the saliva screening program in schools. Mr. Speaker, the ability to offer COVID-19 testing in both public and private schools at every level, from preschool to senior school, and at Success Academy and Dame Hope Academy, is one more tool to help ensure our students can continue in-person learning safely. Bermuda's public and private schools will join other schools around the world that have implemented saliva screening programs and have demonstrated that saliva testing in schools is feasible, acceptable, and effective. These include some schools in Canada, the United States, France, England, and Germany. Mr. Speaker, our research reveals that for schools to sustain saliva screening programs, partnerships are required with organizations that can support, oversee, and coordinate the program. The Department of Education has been very fortunate to establish a partnership with the government's molecular diagnostic lab. Schools are responsible for ensuring the organization of staff, students, and the facility for testing. At the same time, MDL provides all of the equipment, resources, saliva kits, the schedule, and their staff to oversee the testing. This program would not be possible without the partnership with MDL, and we are indebted to them for their support. Mr. Speaker, only students who have parental consent will participate. Each school will know in advance when testing will occur at the school, so parents and students are aware. We are also appreciative of MDL for making special testing provisions for students who are in our ASD and functional skills program and who also attend Dane Hope Academy. Mr. Speaker, the saliva screening program involves each school organizing students in groups as detailed by the MDL team, with one group of students from across classes to be tested each week. Testing groups of students each week will provide the molecular diagnostic lab with samples across classrooms, and it will help determine any COVID-19 risks in the schools on an ongoing basis. Repeated testing increases the chances of detecting the virus at a moment when new infections are occurring or have just occurred. Dr. Karika Weldon, the director of the government's MDL lab, has also advised us that the saliva tests are as accurate as the nasopharyngeal tests. Mr. Speaker, staff who consent to participating in the program will be scheduled for testing based on the frequency of their interaction with others. For example, a member of staff who interacts with many different students or other staff will be tested each week. Staff members who have contact with only some students and some staff will be tested every 2 weeks. Lastly, those staff with fewer interactions, such as one class, will be tested once a month. Mr. Speaker, the Ministry of Education sent out information letters to parents and principals that explain the process that must be followed when participating in the program. On the day students and staff are scheduled for saliva tests, they must not eat, drink, or chew gum at least 30 minutes prior to the test. This involves depositing a saliva sample in containers as provided by the MDL lab with oversight by MDL staff. Mr. Speaker, once MDL secures a saliva sample, the results are available within 24 hours. The results of the saliva test are sent to parents and guardians, not to the school principal or the Department of Education. If a positive test is detected, then the result is sent to the individual's physician or GP and must be followed up with a nasopharyngeal test. Mr. Speaker, a series of town hall meetings were held with the Department of Education staff, school staff, and parents and guardians the week of May 10th. We were also fortunate to have Dr. Karika Weldon and Mr. Tarek Diallo, MDL's school saliva testing coordinator, on hand to present information about the saliva testing program and respond to questions. Videos of these sessions have been posted on the Department of Education's YouTube channel. Mr. Speaker, as previously mentioned, the ministry also sent letters to parents and guardians about the saliva testing program via their respective schools. These efforts were undertaken to ensure parents had various opportunities to receive adequate information to make an informed decision. Mr. Speaker, parents have been sent a link to an electronic consent form that must be completed and returned to the department. As of Wednesday, May 19th, a total of 1,863 parents and or guardians had given consent for their children to participate in the saliva testing program. We appreciate their support of our efforts to make our schools safer. Mr. Speaker, the ministry recognizes when children are not in school full-time and engage in face-to-face learning, this is directly associated with a decline in health, well-being, and educational achievement. We intend to do all that we can to keep our students in school with continuous learning until the end of the school term. The saliva screening program will enable us to do this by being proactive with the asymptomatic saliva screening, which will add another layer of protection against COVID-19. Mr. Speaker, our school staff are doing an excellent job conducting in-person classes while simultaneously implementing various layers of safety measures in classrooms and school, which now include saliva screening program. This regime will be implemented during the remainder of the school year. Mr. Speaker, in closing, I must emphasize that we need families and the community at large to do their part to keep our children and schools safe for learning. Therefore, it is critically important that we follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distance, and download the We Health Bermuda app. Lastly, I encourage everyone to do the research, talk to their doctor, and make an informed decision about getting the COVID-19 vaccine. Let's all work together to keep our students, staff, and school environments safe so schools remain open and in-person learning can continue for the remainder of the school year. Thank you, Mr. Speaker.